Hey, y'all, welcome to the Unleashed Performance Therapy Podcast. I'm here with my co host, Robert McNair. Our guest on the show today is the owner of a new up and coming dry needling certification company, Athletic Dry Needling, Dr. Scott Dixon. Dr. Dixon, thanks for joining us this morning.
Yeah, man. Thanks for having me, guys. I'm
Yeah,
excited.
absolutely. So we'll just jump right into it, man. Tell us a little
Okay.
bit more about Athletic Dry Needling, what it encompasses, and how it sets itself apart from other certification companies. Because there are so many out there to choose from, and those that are either coming straight out of school or just who have been practicing for not that long and want to dip their toe
Right.
into dry needling. It's so hard to choose which one you want to do.
Agreed. Agreed. So let me tell you a little bio about myself first. Might make it easier. So PT was a second career for me, and so when I graduated, I didn't want to feel like a new grad. I was in my late 30s, and so I took 12 Con Ed courses a year for 10 years. I mean, I was a course junkie, and then 12 of them were in dry needling. I've taken every company out there, and
Oh,
then
wow.
people started coming to see me specifically for that. I got a job teaching for another company, as you guys know, 7 years ago, and now that's literally all I do in my practice. I tell people that are new grads, I've been more lucky than good, right? I work with a lot of pro athletes that fly me in to work on them. I've been had the opportunity to meet some amazing people from needling, and so when I left my previous company and started my own, I wanted something that was applicable in a clinic come Monday,
Mm-hmm.
because a lot of the other companies out there, and they're all amazing. I would recommend all of them. I don't ever speak bad. I've learned everything from everybody, and some of them are still really good friends. But some of them have a lot of protocols, or if you don't have your manual in front of you, it might be a little difficult. So I wanted something that because some states only require one class. So I wanted something that people go, okay, I got this. It's not going to be my whole thing, but now I know how to do it for the whole upper and lower body. It's more of a generalized level one course that come Monday morning, you're needling comfortably and safely. So that's kind of what our niche is. And then we go into what are different philosophies with needling, kind of what are the concepts that are out there in the literature. But it's a very surface thing. People go, okay, I'm interested now. Let's look in, maybe another company. I did a
Mm-hmm.
podcast with a buddy of mine. She's like, really, real more interested in like perineural needling. I'm like, oh, you got to go with IDN. And I tell
Okay.
people, if anybody on this podcast is like, hey, I'm interested in this, have them message me because I've done them all. And there's some strengths and weaknesses in all of them. Even in mine, there's some strengths and weaknesses. So there's some companies and some clinicians out there that are teaching some kick-ass stuff. So can I say that on here? Okay.
Yeah, there are strengths and weaknesses in all of those different companies,
Yeah,
and you said there
yeah.
are for years. What would you say the strengths of athletic dry needling are going to be?
Yeah, good question. I think the biggest one is it's applicable on day one, and it's easy and safe to implement. It's all the clinicians that I've taught on day one, they're needling. And second thing, it's a small company. It's
Mm-hmm.
growing fast. I already have 4 instructors, and everybody that I teach gets my cell phone. Sometimes the problem with these big companies, you learn and you're like, and then you're out and you're like, I don't know what to do. I just mean your manual's not helping me. I mean, everybody, I get calls all the time from people that I've taught over the years and I help them. I tell people the funniest one I got, they sent me a picture first and then the text came through. Well, the picture was of a butt with a needle in it. I'm like, whoosh. I'm like, look at my phone and I'm like, somebody just sent me a butt pic. And then the text came through, hey, is this needle in the right place? I'm like, next time lead with the text before you send me a picture of somebody's butt. I'm
No
like, oh my
context.
God. Yeah, no context. But yeah, I think just the applicableness of it and to the various populations. I tend to treat level two, we go more into the athletic
Uh-huh.
population. But level one is kind of generalized for everybody just because what most people want is a tool in their toolbox. They
Yeah.
don't want to do like me. Nobody's going to make this their niche. I mean,
Mm-hmm.
literally all I do in my clinic is dry needle. That's literally
Okay.
why people come to see me. I don't have to sell it. Most people have to sell it and they have to, okay, they need to be able to do the whole body, right? So that's one of the big things. We don't do upper one time and you're like, God, now I got a knee. I can't wait until I take Scott's level two to learn how to do knee. So it does cover the whole body. And I think that's the biggest thing. And then the other thing is that it's fun. The
Yeah.
biggest comment I get on all my evals is like, I didn't even realize this was 27 hours.
Mm-hmm.
We like to have fun. We make it, I mean, you're stuck there. Most people worked all week and then they're getting stuck for 3 days with, hundreds of needles. We got to laugh. We got to have a good
Mm-hmm.
time, and that's my
Yes.
goal. I want to have as much fun doing what I love doing across the country.
Absolutely. And that's always the
Yeah.
goal.
Yeah.
You mentioned that it's important to treat the whole body in that first level one course, and
Right.
I think
Yep.
that is actually very important because I've worked with a couple of people that have taken a course and then they come back and they say, "Oh, we actually just learned from the waist down."
Right.
So I can't I
You
can't
can't do
help
this
this
at
person.
all.
Like,
Right.
do you know how to needle a shoulder or something like that? Because we
Right.
have no idea.
And
We
and
learn
I
from
think
the leg down.
the keeping it simple for level one. It's there's
Hmm.
so much that I've read and that I've learned from taking 12 classes, and I read a book a month. Because now not only am I doing it, but people are looking to me as an instructor. Nobody needs all that. They need, how can I make this applicable? I still want to do manual therapy. I still want to do thorax. This person's got this little problem. I think needles would be beneficial for that.
Hmm.
So that's the big thing. I teach a lot of athletic trainers, and they're like,
Yeah.
I just want something I can add needling. My athletes are asking for it. My doctors are asking for it. I'm not a huge believer, but I want to see how it does. And it's a good intro class. And then it's like, wow, I like this. Maybe Scott's level two, maybe, Master Dry Needling, maybe Sue
Hmm.
Belzoni's classes, which are freaking amazing. So there's a
So
lot of incredible companies out there. Go ahead.
and then jumping into your level two course, you said that's where you start getting into the more athletic population. So what kind of
Yeah,
techniques are specific to the athletic population that you
yeah.
teach?
So we really focus on performance based. So we do a lot of screening pre and post needling. I'm SFMA certified, so I really focus on what the tissue is doing through movement. So we really look at movement and how needling benefits that. We treat joint by joint in level
Hmm.
two. So it's really diagnosis specific. Like, why are they there? What's going on? And as I learned a couple weeks ago, I was teaching down at the Orioles facility, and I'm like, man, that guy doesn't have range of motion. And they were like, he doesn't need range of motion at that joint. That's going to lead him to injury. I'm like, man, I didn't know that. I don't do a lot of
Hmm.
baseball players, so it's that. How is the population different than what we're looking for? Maybe the weekend warrior. How do we treat them differently? And maybe they don't all need certain range of motion at certain joints based on their position or based on their what they're doing, what sport they're in.
Okay.
Yeah,
And
yeah,
yet, so you're looking at whatever pathology that you're dealing with the athletic population, and you're going
yeah.
into it in a certain and in some kind of way. Is it? Are you looking at
Right.
post-op patients, or are you more of a injury prevention approach?
Injury prevention and like as you talked a lot of folks, return to play. That's our biggest. How can we get
Hmm.
people like one of the things I do? I got it from Urson. I don't know if you know Urson Reguloso. He's called the manual therapist. The guy's incredible. He doesn't give anybody. He doesn't do imaging in his clinic, and he doesn't give people diagnoses. Right. So my thing is, what can't you do? Okay, I can't do an overhead squat. Let's get you doing that. Like I'm
Okay.
most concerned about function, not pain. Right.
Hmm.
So a lot of times the general population comes in, my shoulder hurts. The people who come to me or that I want to train people in level two is they hurts when they throw, right? Or they're when they can't push off their gas drop when they're coming off the line. So that's what we're targeting is function. That's the biggest thing. Not necessarily pain management. Recovery and then function are the two biggest things.
You kind of mentioned it. You kind of alluded to the fact that you're looking at what people can't do.
Right.
So that's how you choose who would be a good candidate
Right.
for your needling. Um, So if someone just came in and they are having some kind of pain and it is
Yes.
preventing them from doing
Yes.
multiple things,
Yes.
are you treating that in a certain kind of way? Are you more of a needling at the point of pain, or are you looking at other parts of the body to needle?
Yeah, so we all know that needling can work systemic. It's
Hmm.
there's tons of literature out there. Somebody can come in with shoulder pain, and I could easily justify treating the medial gastroc,
Hmm.
or the opposite side, or the corresponding spinal segment. But the first treatment, I'm always going to treat the area first, more for a sales perspective. I don't want somebody that's getting ready to write me this big check to go, hey, if I do your gastroc, it'll help your shoulder. Because then they're going to be like, I don't know about this guy. Right. And in some states, that's not allowed. In Illinois, you can't do that. You
Oh,
can't do
really?
proximal or distal points.
Huh.
You can only do it. So they got it approved. They can't leave it in there. They can't stem it. And they can't do proximal distal points. But
Oh,
as I
man.
work backwards, somebody comes to the shoulder, I'm going to treat the shoulder. Second visit, I'm okay, that's better, but now let's go cervical spine, thoracic spine, Let's look at your opposite lat, look at the opposite glute med, and then that works. And then we keep working our way
Mm-hmm.
further to find out what the tissue dysfunction is, because we know it's not. Anyway, I go into explaining the whole biotensegrity model. How can this and my gastroc affect this? Is it the nervous
Mm-hmm.
system? Is it fascia? Right. So that's kind of fun. That's, to me, that's my favorite patient. I don't know what's wrong. I don't want surgery, and you're kind of the last hope. Those are my favorite people to treat. The non-surgical. If
Yeah.
you go to ortho and it's not surgical and you're in pain, they're like, go do PT. I don't
Yeah.
want you in my clinic. You're not
Yeah.
surgical, but you're hurting. Good luck. Go do PT. And then they do
See me again in
PT.
6 weeks.
Yeah, they do PT, and then they're frustrated. And unfortunately, as you guys know, you've probably talked to me, but there are enough clinics out there that are ruining our reputation, as there are clinics that are helping it. I mean, there's
Mm-hmm.
amazing, I've seen them in this country, but kick-ass clinicians. But there's a lot of those where you go in here, everybody gets the same routine.
Mm-hmm.
It's the same thing with chiropractic. I've worked with a lot of chiropractors, and there's ones out there that do the same, flying 7 on every patient. And there's others who are really patient specific, and I think that's where our profession needs to be going. We're one of the few professions that have time with our patients. We have 30 minutes to an hour to really connect with them and treat them as a person. So I know that's kind of off topic, but
No, I agree
for sure.
100%. I
Yeah.
think that I think it's a major problem, and a lot of it has to do with insurance,
Agreed.
specifically in physical therapy. You have really good physical therapists and you have really bad physical therapists. Because people are always asking me, how do you feel about chiropractors? Because
Right.
there's this big divide between chiropractic care and physical therapy
Yeah.
care. And I'm always one to say, there are good chiropractors, and then
Yeah.
there are really bad chiropractors. So, they can
Well,
get you in
somebody
there, crack you real quick, and then you're good to go.
somebody asked me once, a couple of other teaching companies like, "Are you want to teach PTA?" Right? Because in Texas it's allowed. And I'm
Mm-hmm.
like, you know what? I have seen people that shouldn't be needling in every profession. I've had PTs walk out. I'm like, man, I'm a little nervous about this, right? And I've had PTAs, I've had chiropractors, and I've had other people that are just nailing it. So I don't
Yeah.
think it's a profession. I think it's whether somebody's really eager to
Mm-hmm.
learn. Like I have shirts that I give out to people in class,
Okay.
and on the back it says hashtag never stop learning.
Yes.
And that's the key. Some people are doing it, and you can tell when I'm asking everyone their name. Some people are learning it. Oh, my boss wants me to do this. Or other people go,
Mm-hmm.
dude, I'm stoked, man. I've read about this. Those are the people, guys, if I told you some of the horror stories I've heard, my favorite one is someone asked me if they've had a laminectomy, do we still hit the lamina? No, because it's
Well,
not
you
there.
can
Okay,
try.
cool. I said they're pretty cool, and they walked away. I'm like, really? And I had one girl raise her hand. I said, we're doing infraspinatus. She goes, is that in the shoulder? I'm like,
Oh
oh God.
no.
I'm like, oh God, this is going to be a long weekend.
Oh
But
man.
again, it's not profession specific. Everybody,
Yeah.
there's some I've met some smart
Mm-hmm.
people, way smarter than me, and I've met some people that, you know, are challenging when it comes to needling. And my most
Yeah.
important thing is safety. This is my company. If somebody gets hurt, they're not going to sue that person. They're going to come after the company. So all my techniques are extremely safe and easy to apply.
Absolutely. Well, the question that we always get, and since you have so much experience with dry needling and what 12, you said it was 12 different
12 different
certifications,
companies, yeah.
12 different
Yeah.
companies. So I'm eager
So
to hear
six
what
different
you.
companies, six
Oh,
different
six.
companies, level one, level two.
Oh,
There's
okay,
12
okay.
classes.
Yeah,
Yeah.
that makes sense.
Yeah.
I'm eager to hear what your point of view is when people ask you. I've never really heard of dry needling. What is it? How do you
Hey,
answer that
how do I
question?
tell the layperson? It depends on where I am.
Mm-hmm.
So I tell my students, because we really want to watch that line between acupuncture,
Yeah.
right? So if I'm at the airport, or a restaurant somewhere when I'm traveling, people say, what do you do? That's the worst. They're like, oh, what do you do? I teach dry needling. What? I'm like, it's like acupuncture. Like, it's not worth going into. And
Yeah.
I've started the point now where I just lie. People say, what do you do? I'm like, I'm a gynecologist. Because I don't want to explain.
Just leave it.
I don't want to explain to them what dry needling is.
Yeah.
That's easier to explain to them.
Much
Look at, much easier. But if I'm in a clinic, I don't make that comparison. I know there's some companies that do call it Western medical acupuncture,
Okay.
But if I'm clinic, I'm not. My
Yeah.
definition, I tell my students, I said, hey, I'm going to put a thin filiform needle. So they always use the word small, thin, into muscles, ligaments, tendons, and bones to restore normal biomechanics. That's all I tell them. Right? Remember how you're having trouble with this? I'm going to help you do that.
Mm,
Cool. I keep it simple. Normally I say homeostasis, but most patients don't know it.
yeah.
Homeostasis. I say normal biomechanics. You're having trouble with your right knee when you squat. I'm going to use a thin needle to help you get that back to what it should be. Cool.
Okay.
And
Okay.
the problem is like when people try to sell it, I work with a lot of NFL players and I say, hey, get me more guys. And they're in the practice going, hey, you want to come get needles? And they're like, hell no. Because especially we're like, we don't think it's syringes. That's what we think of in
Yeah.
Western medicine. I hate syringes, but I'm okay with needles.
Yeah, it's
It's
probably
funny.
best to keep the word acupuncture out of the name.
Yes, absolutely. Yeah, just the funniest one. I had a guy years, this was 7 years ago, and he did a Facebook Live because they just learned dry needling about the difference. And I literally had to text him. I said, dude, that's wrong. Can you take that
Oh,
down? Like what
oh
he
man.
said was the difference, and it isn't. And I tell people two things you're going to get in the clinic on day one. As soon as you take this class, everyone's going to ask you, what's the difference between
Mm-hmm.
acupuncture? I hear that 7, 8 times a day, right? And then what is dry needling? So you need a
Yeah.
definition like mine that I use, and then you need to describe the difference, you
Okay.
know?
And
So
that difference in your description would be
for me, it's the reason why we put the needle where we put it. It's the
okay.
why. Like if the sound was off and you watched me dry needle and you watched an acupuncture, there's no difference, right? But why am I putting the needle where I put it? So I put it because of diagnosis. Why are they there? Functional testing and palpation. That's why I put it. It has nothing to do with their energy, their meridians. I don't know if you guys ever had acupuncture. I had it once, and they look into your eyes for like 2 minutes. I got ADHD. That felt, I mean, the guy was looking in my soul. He knew what I did in
You're like,
second
what's
grade.
going on?
Everything I ever did wrong in my life, he was looking in my soul.
All the
Right?
secrets.
Look, it's deep, but it's an amazing. People say, "Oh, well, you don't believe in that." I'm like, no, it's a huge fan. I think it works.
Yeah.
So the joke that I tell my students, and it's funny because not everybody in class gets it. I said, and I see who laughs and doesn't laugh. That's why I know how appropriate I can be during class or inappropriate. I say you can do acupuncture for quit smoking. You could do acupuncture for anxiety. You can do acupuncture for pregnancy. If I dry needle somebody and they get pregnant, I did something wrong. And some people go, wait, what? Never mind.
Yeah.
Not
Writing
everybody
notes
gets it.
there.
Yeah, right. I'm doing something wrong in my professionally. But yeah, it's if I'm in the clinic, I don't use the word acupuncture, and I have
Yeah.
100 hours in acupuncture.
Uh-huh.
That I've taken. It was 2 grand for the course. I got nothing, no certificate because it was a
Oh
chiropractic course,
man.
and I just took it because I wanted to learn. It was all
Mm-hmm.
online. I think my instructor was stoned half the time. It was kind of fun. He was a big long haired hippie. He's like, man, we're doing this. So it was pretty fun.
That's a good experience.
It was awesome. It was a great class. But now I know where the points are, and it's definitely a difference. I mean, you need to know, you need to have a
Yeah.
concept, especially when you're in clinical research. Their research is amazing,
Mm-hmm.
So you don't want to profess to do it, but especially for like low back pain and for knee OA, you could follow their protocols, but just by using the anatomy of where those points are. You're not doing acupuncture, but there's some really good literature for knee OA and low back pain. Medicare covers low back pain for
Mm-hmm.
acupuncture, but not dry needling.
Hmm.
But you can look up and go, hey, this, bladder line is here, and you can just do the anatomical version. Most acupuncture points correspond with something, either a fascial point or a trigger point. If you look them up and laid them over, we're all
Mm-hmm.
doing the same thing. We just call it something different. So,
Yeah. Okay.
You have all your the credentials you have and your reputation,
yes.
and of course you're working with these like high level athletes, stuff like that.
Mm-hmm.
So it's not really hard to sell for them, of course, because it's their livelihood. But do you
Right.
still run into, I don't want to say issues, but are there times where you're working with the athlete and it's just kind of not clicking, whether it's the actual needling or them themselves?
You mean getting in to try it or getting the outcomes?
The
Maybe
buy-in.
both. I think definitely, like I said, you're getting flown out, so them
Yeah.
actually hearing word of mouth from other people, they're ready to
Right.
try it. Has there been times where the outcomes really haven't been?
Yeah, absolutely, absolutely, and unfortunately, that's with needling. Yeah, There's a really good sports performance place here that I've worked with some. They mostly do quarterbacks, and I've worked with names. I mean, I was starstruck. Like, I don't get starstruck.
Mm-hmm.
A lot of times these people were, I'm like, I just saw you in this certain event that happened
Yeah.
in February, right?
Yeah.
Nice.
I'm like,
Yeah.
that's impressive. You're a celebrity to me. And
Yeah.
then there was one guy, I think he was a backup quarterback, and it was something in his elbow, and I treated him twice. It didn't help. I'm like, okay, I mean, I get it.
Mm-hmm.
Some people I treat them like, oh my God, you're like, Jesus with a needle or something. But yeah, there are some non-responders. And then I had one, he was a D lineman with the Jags, and he had something in his foot, but he's like, don't put a needle in there. And anytime I walk by, his feet, doc, 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 doc. I'm like, I'm not going to do it. Doc, 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 doc. I'm like, dude, I'm not going to put a needle if you don't want me to. He was so scared. Anywhere else, but he wouldn't let me needle his feet. And I'm walking to the rest, doc, 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 doc. So some people don't want needles. Other people they just love it.
Mm-hmm.
But yeah,
I
some
don't.
people are non-responders, unfortunately.
Yeah, and it's not like needling is this magic pill either.
It
So
is not.
you kind of
It
may
is
have to
not.
make sure to explain that to them beforehand. This could work, but it might not.
Yeah. Well, what I've started doing, and I even tell my patients this, I don't charge a lot, but I see them for a half hour, and I charge $120 for a
Mm-hmm.
half hour. And so the biggest package I do is 6, because I'm like, if you're not 100% in 6 visits, let's find out something else. Needling's not for you.
Yeah.
And they're like, that's a lot. I said, okay, well, how about you do this? Don't pay today, right? Let me needle, you go home. And they're like, no, I want to pay. I said, well, if you wake up tomorrow and you're not better, and you just paid $120, now you feel like you just got scammed. What if you wake up tomorrow and you're better? This will be the one of 6.
Mm-hmm.
So I give them like a sample. I call it the drug dealer approach. And every time in the last 12 years, they call me and go, dude, I'll get the package. Because I don't want them to feel bad. They wake up tomorrow and
Yeah.
they're like, man, that sucked. I said, well, then no love lost. Let's find you a clinician that is manual, ART or something. I don't have anybody paying the first session. And I'm telling you, not 100, but 90% of the time, they call me the next day and they go, I'll do the package. I have
Do
one
you
guy comes in, he hates it. He hates needling. He hates it. I'm like, why do you come back? Because it works.
Yeah.
All right.
Results.
Do you advertise the drug dealer approach?
I don't. Yeah, I'm gonna get a whole other client base, right?
Yeah, you get some different calls in.
Yeah, different calls. Somebody outside my door at 9 a.m. Come on, doc. I need some.
I heard you got it. We heard you got it.
Just one needle. I heard you got the needles, man.
For those that are new to dry needling, or those new grads that are coming out of school and taking your course for the first time, and they're interested in working with the athletic population, what kind of advice would you give to clinicians, or even someone like me? I've been needling for a few years now.
Oh, nice.
What kind of advice would you give for us to be treating the athletic population?
It depends on which athlete. It's
Mhm.
if when you're working with the pro athletes, take more classes. Take all the different styles. I mean, I've got a friend of mine now. I'm trying to connect him with the place there in Tampa. And he was just, you could tell from the people that were there, he's just nervous because, if you injure a high school athlete with needling, your parents might be a little mad. You're okay. You injure a pro athlete, there's somebody's coming after you. You're looking at, I mean, that's those guys, this is their career. And so you could see, like when he's on a general pop, he's like a ninja. You get over the pro, he's like, So just get more experience and get the diversity. I love the different. I remember the old company I used to work for used to do video testimonials. And one guy got on there and said, hey, I've taken 4 other courses and this is the best. And somebody commented on that post, what kind of idiot would take more than 1 class or 2 classes? And I'm like, I took 12. And yes, it was kind of boring a couple times. But I'm like, oh, that's cool. I didn't see that way. That's a new way of doing it. I've learned something from every class I've taken. And then now I'm trying to apply that and use it clinically. But if you're going to be working with the pro athletes, get lots more practice, take more classes, learn different approaches. And there's not a single company out there I would say anything bad about. They're all amazing. Even my previous employer, it's an incredible class. You had Ken on the podcast. He's the freaking goat. Ken's a goat. I mean, he's the greatest dry needle I think I've ever met. And the greatest guy. I mean, amazing. Huge fan. One of the nicest people you ever meet in this earth. Yeah.
Yeah, absolutely. Absolutely. Yeah. Well, I have similar values as you, I think. I really enjoy learning. I'm always looking to learn something new. Even if it's something that I've had previous exposure to. I want to see how I can do it differently,
Yeah.
right? So
And
because it's not going to work the same for every single person. So
no.
you've got to have different approaches to things.
Right. Yeah, I think what's the old saying is that when you're the hammer, whole world's a nail. Like if your go-to is, joint mobs, and joint mobs
Hmm.
didn't work, then you're like, now what? And the ability to, I think what hurts a lot of time in a profession is the ability to say, I don't know. I think we're scared as clinicians that our patients won't respect us if we say that. And I'm like, dude, this should work. It's not. Let's help you find somebody. I've referred out so many times. Like, I don't
Hmm.
have time in my clinic to do corrective exercise. I think that's the go-to. That's the long fix,
Yeah,
right? But I don't a lot because of the athletes that I treat have a PT. They have a strength coach, right? I'm literally
that
there
makes
just to
sense.
needle them. Yeah,
Yeah,
they come to me, and if I teach them exercise, I'm getting a call. Hey, what'd you do? That's not in
yeah,
my scope. They send them for needling. But I'm telling you, if I get a general population, they're like, well, now my shoulder's better. How to keep it away? Go do this PT. Go see this guy. He's amazing. I just don't have time in my clinic because we all know long term, it's corrective exercise. Teaching people how to move right. Needling's not going to fix everything, right? It'll fix the tissue. Now you need to learn how to keep that correctly. When I
hmm
get somebody moving correctly, good. Is it going to go away? Probably. Now that you've done it, let's go get somebody to teach you how to keep it. You know, it's not the long term fix. Nobody should see me permanently. The only people I continue to treat are the pro athletes because they're getting in a car accident pretty every week, especially an NFL player.
yeah.
I couldn't even last 5 minutes in there.
It's rough. It's
Yeah,
rough. The things that their bodies just go through
that's
some
insane.
torture, man.
There was a
Um,
guy, I don't know if you remember, it was called Sports Myth, Sports Science. It was on ESPN, and he did all the physics
Yeah.
oh
calculations.
yeah,
He wanted to
it's a
see what
great
it would be
show.
like to be hit by a lineman. He went back 8 feet in the air
Oh my
and
gosh.
took on a full hit from a D lineman. I'm like, dude,
They really got to
he
bring that show back.
he went
That looks
flying. I'm
cool.
like, the rest of us, and like I'm like 6'2", I would look like a rag doll being hit by how hard those guys hit. It's
Monsters.
crazy.
Ridiculous.
Monsters.
It's insane.
So, athletic dry needling. How long have you been, or when did you start the company?
November
Okay,
last year.
Oh
Yeah,
wow.
and
okay,
it's
and,
it's
and you're already in
so
multiple states.
I'm already so I got really lucky because the benefit I had with my previous company is the reputation of really treating people well as I
Hmm.
traveled and having fun. So when I left the other company, I reached out to 20 people, said, "Hey, I've started my own. Can you host?" And they said, "Absolutely, absolutely." And then I'm getting just calls after calls, and
Yeah.
just very lucky. We have a spinal manipulation course that we do as well
Okay.
that we're trying to grow. So I have two chiropractors, one from Wisconsin, one from Rhode Island, and
Hmm.
they've written the whole content. I don't do it, and they're teaching that to PTs, athletic trainers across the country. Just a level one, just an SMT
Yeah.
one. Again, just something you can have in your toolbox.
Yeah.
I've taken 10 manip courses, and I'm like, if
Hmm.
I do it, great. If it helps you, great. If not, go see an amazing chiropractor because
Yeah.
I'm just a beginner. I'm a beginner. Can I do
Hmm.
it? Can I adjust your C spine? Yeah. If it helps, great. If not, go see somebody who's really skilled at it.
It's nice that it really shows if you're good at your job or if you're good with people in general, you're gonna have some good outcomes and you're gonna have
Yeah.
people that want to work with you. So it's nice to see that.
I think
So
that's the
what?
biggest thing is just relationships.
Yes,
That's that's
100%.
that's how my company's going so fast. Is the person that I've been for the last 7 years. Just
Hmm.
that karma's coming back. I didn't do it because I wanted my own company. I did it because I just love teaching, and now it's coming full fold. All those people, like, yeah, we really grateful, and the reputation that I've created is coming back, which is amazing. You
That's
know.
great to hear. And speaking of growth, what does the future of athletic dry needling look like? What's coming down the pipeline? Do you have anything in the works? Any special?
Yeah, it's funny. A lot of people ask about ultrasound guided, and
Oh yeah.
it's it it's not really for us. It probably
Hmm.
won't be something we do. I think it's definitely clinically valuable. I think we're just trying to get more courses. I don't want this to be huge. I do it because I love it. For me, down the road is I want to get off the road. I
Oh
want to
yeah.
cut back teaching. I want to get my other instructors. It blows me away how humbled I am by the fact that people want to teach for me. I'm honored. And they're like, oh my God, you're
Mm-hmm.
giving me a job. I'm like, oh my God, you're working for me? Like, I'm grateful. And they're like, we're out gratefuling each other. Like, I'm so humbled that you want to make money while I'm making money. And they're like, no, we're making money. I'm like, every day I text my staff and go, I don't know how I got so lucky. You
Yeah.
know, everybody in our team is all former students. You know, I
Mm-hmm.
don't, nobody's outsourced. So the guy who does all my marketing and all my credentialing per state is an athletic trainer in Kansas City, and he's crushing it. You know, and he's just, I'm humbled every day that these guys are willing to go out there and teach. You know, it's scary because if they
Mm-hmm.
do something wrong, it's on me, but
Yeah.
it's amazing. I really look forward. I got twin little girls that are 12 years old. I'm raising on my own. So when I'm traveling, it kind of sucks. So that is my
Mm-hmm.
goal. I've done it for 7 years. I want to cut back to maybe once a month. That's my goal, and then let these guys just run with it. You know, I've got a clinic here in Ponte Vedra that I'm at, and I get paid well to see the athletes.
Mm-hmm.
So that's kind of where my focus is going. You know, some of these guys will pay 3 grand for you to come up for a day.
Oh man,
It's
that's nuts.
insane. Yeah.
Yeah,
So if
that's
I have four of
crazy.
those in a week, that's a decent living. You
Yeah.
know?
No
You're good to
complaints.
go there, man.
Yeah.
I'm sitting here quiet because of course you have of course the experience, and
Yeah.
I'm not certified or anything, but of course definitely after graduation
Oh,
I've
come on.
I,
I got
I've
you, buddy. I'll take care
and
of
the selling point
you.
definitely was make it applicable on Monday, because
Yep.
definitely me being a tech for so long and seeing the dry needling, understanding it, the actual courses, I definitely thought, or in my head, okay, there's a series of courses that you
Yes.
need to do to be comfortable, to be able to
Yes.
treat this person, all that. And kind of in my
Right.
mind, that's what I was preparing myself for. But when you said that, it's like, okay, this is something I can jump into, kind of hit the ground running and going
Right.
through
Oh,
it. And
absolutely.
I definitely like the that approach or that
Yeah. And
tactic you use.
what I would do, I don't know, but if anybody in the next year mentions you guys, we'll do $100 off.
Oh
So
wow.
anybody who reaches and say I saw them on this podcast, it'll be
Mm-hmm.
$100 off our course, and we're only 9.95. So
Okay.
any of your subscribers will get it for eight
Mm-hmm.
ninety five, level one or level two. You
Nice.
know,
Okay.
yeah.
I
So hope
definitely
that
work
helps.
with some
Yeah,
clinicians leaning towards the dry needling too. So
yeah,
definitely put
absolutely.
that out.
Yeah,
So
that's
is there a particular sport that you lean more towards that you like treating?
Me is treating NFL.
NFL? Yeah.
Yeah, that's funny. I was in New York last weekend, and I was working on some mixed players. I'm like, this is different. Like their bodies are different. You know,
yeah.
give me an NFL player. I've done a lot of MLB just because of athletic trainers that I've taught. So probably football and baseball are
Yeah.
my two biggest. You know, I don't know enough about a basketball athlete to really know what is. You know, that's why I watch it, obviously, but football is probably my biggest one. You know,
I
I
definitely
think once you get in one sport and your reputation gets out there, I mean, I'm going Thursday to treat a pretty big name. I'm like, oh man, this is exciting, you know. And
nice.
he's like, the gauntlet's been laid. I need to be ready, and if you're not ready, then I'm not going to have you work with me again. I'm like, okay, awesome, no pressure there.
I feel
So
like NFL would be like that. Like you said,
it
they're
is,
going through these card wrecks a
it is.
hundred times a game, and it's like, hey, okay, let's get in here, let's get to work, let's fix it. And then the example you use with the baseball is like,
Yeah.
okay, this didn't work for me, or they're real intricate on certain
Yeah.
joints and stuff like that. So I can see football being a
It's
kind of
nice
a better
because
one.
they're used to a little bit more discomfort, because their sport is so physical.
Mm-hmm.
It's baseball players are athletes, but they're not used to getting that. They're incredible athletes. I couldn't even handle one inning,
Oh
but they're
yeah,
not used to the physical contact.
definitely.
So when you put a needle, like, oh, I don't know if I'm down with that, but they get great outcomes and they love it. Football's like, dude, I just got my ass kicked on the field. Dude, what's really neat to watch is early in the season, it's like, oh, do all this, do that. At the end of the season, they're like, just put some needles. I
Just go
mean,
ahead.
and it's recovery. Like they don't need anything. They just need recovery because they're beat, they're tired. I mean, now the season's what, 20 something weeks? I mean,
Yeah,
it's insane. So at the end of the season, I'm just letting them sit. I mean, needles in there for a half hour minimum to really focus on recovery. I'm not pistoning, I'm not scanning, putting them
Mm-hmm.
in there and just letting it sleep and putting the stem on. My advice, as we talked about earlier, to new clinicians is just take as many as your company allows you. I think if
Yeah.
and they can reach out to me anytime. We'll do my information here at the end, and it doesn't matter if it's my company. I don't care. I think it's a great modality and learn it. I mean, I think it's almost mandatory now for jobs. I think if you're coming out as a new grad, it needs to be on your resume because they're like, can you dry needle? No. Okay, well, I need you to get certified the next year because people are just asking for it. I mean, it's it's kind of like going somewhere and like, oh, do you tape? No, I've never taped before. I'm like, everybody's taping it. I mean, that's like saying you don't do joint modes. It's kind of everybody has that in their toolbox now. It doesn't really differentiate as much. So yeah, definitely consider. I don't know what the laws are on in different states. I just found out yesterday that one of the girls that works at this place that I go to in Florida only has one class, and in Florida requires two. So I don't know how that person. So please make sure you guys know your state laws before you start needling.
So where can people find out more about you, more about Athletic Dry Needling, and getting in touch with y'all?
So I will humbly say that our website is awful. I have not gone in there and done content. I mean, we just started in November. Like it's a lot of people say, can I go to your website? But it doesn't describe our philosophy. But it can help you connect with us. So it's athleticdryneedling.com. Instagram, Athletic Dry Needling. Everything is athletic. Facebook, Athletic Dry Needling. My email, athleticdryneedling@gmail.com.
Okay.
Right. So you just go with Athletic Dry Needling. And again, I'll say this one more time. Anybody has any questions about anything. When I did the Facebook Live, a friend of mine, somebody called me with a clinical question about dry needling. And I'm always happy to help. I've been humbled to have what I have because of this technique. And I'm happy to spread out with as many people as I can. So
yes, sir.
Everything's Athletic Dry Needling.
Cool. Well, yeah, absolutely. But before we let you go, got one more question, kind of throw you off a little bit. Okay. So you're obviously a great clinician. You're a great leader. You started this company and it's flourishing. So what does being a leader mean to you?
Excellent. I like that one. There's a really good quote that says, you can have anything in this world if you help enough people get what they want. And to me, that's what being a leader means, is putting other people first, right? So if I'm up here making 20 million and my staff's making 100,000 a year, that's not a good leader. I'm like, how can I spread the wealth, not only professionally, but education-wise? The other thing is I tell my staff, my goal is to hire people smarter than me. I don't need to be the biggest ego in the room, right? If you know more, and being humble and being concerned about the welfare of everybody in your organization, I think that's the key. I've got one of my clinicians that every time I call him, he's like, hey boss. I'm like, I'm not the boss. Yes, I started this, but we're a team. And I think treating people that way, a lot of times leaders of clinics like, hey, this is my clinic, do it my way. And they've got these really great clinicians that they're stifling. They're not letting them be who they are. I think every company needs to do more Con Ed, without a doubt. Every company needs more Con Ed budget. These clinicians need to learn.
Love that.
Hopefully that answered your question.
Yeah, absolutely. Love it, man.
Making people the best versions of themselves. That's what my goal is.
There you go.
Whether it be paid students or my employees. That's the goal in life. Right?
Yes, sir.
Nice.
Cool, man.
And that's Dr. Scott Dixon. Awesome. Athletic Dry Needling.
Yeah, I appreciate it, man.
Yeah, we appreciate you coming on, man, to taking the time out of your Sunday morning to be on here. We really do appreciate you, man.
Yeah, have a good one, guys. Be good.
I'll make sure to put all your information in the description, and $100 off for anybody who mentions hearing about you on the podcast.
I'm gonna need that deal to go for another 3 years. So once I graduate,
you get a lifetime deal.
Hey, there we go.
3 years from now, I'm like, sorry, who are you again? You told me 3 years ago I get $100 off. I'm like, wrong number. Scott, no here.
Oh, I heard you got the good stuff.
All right, guys. Well, that's going to be it for this episode of the Unleashed Performance Therapy Podcast. If you have anything you want us to talk about on the podcast, shoot us a DM on Instagram at unleashed.tx. And y'all, be sweet to me. Scroll down to the bottom, give us a 5-star review, share the podcast with your family and friends. And until next time, peace.